Dear students, welcome back. In the previous session, we have discussed about the angles of femur in that angle of torsion. Okay, now in this we are going to discuss about the articular congruence. Okay, so the hip joint is considered to be a congruent joint. However, there is substantially more articular surface on the head of the femur. So it is having more articular surface on the head of the femur when compared to that of the acetabulum. Okay, in neutral or standing position, the articular surface of the femoral head remains exposed anteriorly and somewhat superiorly. So if you can see here, so this is in the normal standing position. So some of the articular surface of the femur is exposed outside anteriorly as well as superiorly. Okay, and so the acetabulum, so why such thing happen means the acetabulum does not fully cover the head superiorly, and the anterior torsion of the femoral head, because of its anterior torsion of the femoral head, there is a substantial amount of the femoral head's articular surface anteriorly. So for that reason, the acetabulum is not covered the head of the femur superiorly as well as anteriorly. The articular congruence, contact between the femur and acetabulum, can be increased. Okay, see it. So the congruence between these two surfaces can be increased in non-weight bearing hip joint. So in non-weight bearing hip joint, this is non-weight bearing hip joint, by positioning the hip joint in the combination of movements, that is flexion. So here the hip joint is under flexion, okay, and then abduction. So flexion, abduction, and somewhat lateral rotation. Slight lateral rotation causes maximum contact between the head and the acetabulum. You can see the articular congruence is increased in this position, isn't it, than in this position. Okay, so commonly this position is called as frog leg position. Okay, so the articular congruence, contact between the femur and acetabulum, can be increased when the femur is flexed, abducted, and laterally rotated slightly. Okay, this position corresponds to that which is assumed by the hip joint in a quadruped position. Okay, so according to Kappanji, this position is called as true physiological position of the hip joint. This position is called as true physiological position of the hip joint. And some studies regarding articular congruence, some investigators concluded that from their work and from the evidence in the literature, that hip joint actually functions as an incongruent joint in non-weight bearing. So they have found that the hip joint functions actually as incongruent joint in non-weight bearing. So we have seen the non-weight bearing which is congruent. That means we have to maintain such kind of position. Then in non-weight bearing it can have maximum articular congruence. Okay, in normal non-weight bearing, in any other positions other than this position, In any other positions, it doesn't have congruence. That means in any other positions, it is incongruent. Okay. So in weight bearing, the elastic deformation of the acetabulum. So what happens normally? It is like this, acetabulum. Once the weight is applied, what happens? The elastic deformation of the acetabulum. What will happen? Increases the contact. So this will spread like this. Okay, this will spread and increases the congruence of the contact with the femoral head, with primary contact at the anterior, superior and posterior articular surfaces of the acetabulum. So the deformation, the elastic deformation of the acetabulum increases contact with the femoral head with primary contact at the anterior, superior and posterior articular surfaces of the acetabulum. Normally, so the anterior and superior sides, the acetabulum is not covered properly, isn't it here? So when weight is added, so the elastic deformation of the acetabulum, which primarily covers at the anterior side, posterior as well as superior as well as the posterior aspects. Okay. And also an additional contribution to articular congruence, another joint structures which are non-articular and non-weight bearing structures called as acetabular fossa are also involved in such kind of function. Okay, how this acetabular fossa, which is actually non-articular, and how this fossa is going to help in such kind of weight bearing functions means the acetabular fossa may be important in setting up a partial vacuum in the joint. So it creates some vacuum in the joint so that atmospheric pressures contributes to stability by helping maintain contact with the femoral head and the acetabulum. So this fossa creates a vacuum inside the joint, which helps in maintaining the contact between the femoral head and the acetabulum. And also some of the investigators concluded that the atmospheric pressure in hip flexion activities played a stronger role in the stabilization than capsulo-ligamentous structures. So during hip flexion, this pressure plays an important role in the stabilization with that of some structural things which are going to support in that position. That means capsulo-ligamentous structures actually give stability. So this pressure is more effective in giving stability when hip flexion activities than that of the capsulo-ligamentous structures. And it is also true that the head and the acetabulum will remain together even in an anesthetized patient, even after the joint capsule has been opened. Okay. So the pressure within the joint must be broken before the hip can be dislocated. If the hip is going to dislocate, means before dislocation the pressure also should be broken. Okay. So, and the other structure, that is labrum, which enhances the joint stability not only by deepening the acetabulum but also by acting as a seal to maintain negative intra-articular pressure. Okay. So it deepens the fossa and also it acts as a seal not to escape this pressure, not to escape this pressure inside the joint. Because of this labrum only, the space inside the joint is created and the pressure is created there. When there is any labral tear is present, the labral's ability to act as an support to prevent excessive movement and to act as a seal to maintain negative intra-articular pressure may be affected, and also placing increased stress on the surrounding capsule. So all these structures other than the acetabulum and the femoral head, the other structure also helps to maintain the articular congruence, that is acetabular fossa and also acetabular labrum. Okay, so this is all about the articular congruence. Thank you.